Ready to introduce Dr. Eduardo Salas. This is a real honor. I was saying last night, in the last couple of weeks, I've had two different groups of people ask me to find out more about team-based effectiveness in CME so we could develop programs here. And I've been sort of scratching my head a little bit, thinking, where am I going to find something? And then last week, Ward Fleming said, hey, can you join us for dinner? So last night I got to sit with the king of teams for dinner. And I'm feeling very fortunate to have had that honor. I'll tell you a little bit about Dr. Salas. So he's the trustee chair and professor of psychology at the University of Central Florida, and also is the program director for Human Systems Integration Research Department at the Institute for Simulation and Training. And for those of you who don't know, when you say University of Central Florida, people say simulation. It's a big, well-known center for simulation. Previously, Dr. Salas was a senior research psychologist and head of training and technology development branch of Naver Orlando for 15 years. And during that time, he was a principal investigator for countless R&D programs looking at teamwork, team training, advanced training technology, decision-making under stress. Some of you may know something about that. Learning methodologies and performance assessment. To give you some idea of the scope of his career, he's co-authored over 300 articles and book chapters, and has co-edited 15 books. He's been on the editorial boards of journals across a huge spectrum in this area: applied psychology, personnel psychology, military psychology, just picking a few here, Journal of Organizational Behavior, and he's a past editor of the Human Factors Journal. And listening to Dr. Salas tell us about some of his experience last night, he's done some really fascinating work, and he's certainly worked in healthcare, but he's also worked with the oil industry, stockbrokers, the aviation industry. He knows a lot of things about a lot of things. So I think we're in for a real treat this morning, and please join me in welcoming Dr. Salas. It's such a pleasure to have you.
Thank you. I think I might. Good morning. Oops. Good morning. Okay, there we go. Oh, we have a special guest. That's good. This is going to be a test of the presentation, if I can keep her awake. Good morning again. Thank you for the wonderful weather. I came prepared, like I've been telling for the last 2 days, came prepared for 22 below. And I'm going to the mountains this afternoon, so if they let me go, because I've been captive here for 48 hours. You might be wondering what happened to the original title. A little false advertisement. But I think what happened was yesterday when I came in and saw some of the students and what you were doing, I thought that I will give a different kind of, a different presentation. So the presentation I had prepared was essentially a meta-analysis of medical team training. So I thought, well, that's a bunch of correlations, a lot of statistics, boring. So I picked up this presentation that I gave about 3 months ago at a healthcare conference. And essentially what this does is a presentation that gives you a world's tour, if you will, of what do we know about teamwork? What do we know about team training too? And so I thought that would be more useful to you. It's very practical. This is all translational stuff. Very little data here. But it's, what is it that we know from the science of teamwork? What do we know effective teams do? So that's what this is going to be about. 45 minutes or so, I'll walk you through this. I'll be glad to share this presentation with anybody. I can leave it here. You can distribute it. There's my email in case you want copies of this. Everything that I'm going to tell you today has been published or about to be published. So if you want longer papers or shorter papers on this topic, I'll be glad to send it to you. Okay? Everybody with me? Okay. So a few takeaway messages before I get started. The first one is, should be no surprise, I hope, that there's a science of team performance, of team training. And this science has been in existence, I'm guessing, for the last 30, 35 years. Before I became an academic, I've been at the university 15 years. I worked for the U.S. Navy as a research psychologist, like it was said earlier. And I was hired to do nothing but develop a laboratory for team performance, team training research for the military. So essentially for about 30 years, that's what I've been doing. And not only me, but a whole bunch of other organizational psychologists, which is what I am, or human factor psychologist. So there's a science, and I hope that you learn about it, because there's a lot of good science out there, a lot of evidence out there that healthcare can use. And I'm going to try to give you some idea of that. The good news about this science is it has produced a number of tools, guidelines, principles. There's a wealth of information now about what to do to increase teamwork, to foster teamwork, to develop teams. And I'm going to give you a little bit of that science. There's also now at the beginning of there's some evidence now that teamwork works. It saves lives. And I'm going to give you a little bit of that meta-analysis that I just completed. And just to give you a sense of it, there are 225 articles on medical team training that they have collected data, pre-post, post-only, or qualitative data. And I'm going to give you a summary of that meta-analysis as I go along. So, and there is, very compelling data that has emerged, about 3 or 4 articles that have basically shown that team training leads to less mortality. Some of you might have read the JAMA report in 2010, Nelly et al. On the VA system in the U.S. that essentially showed 18% reduction in mortality. Not a perfect study, I will tell you that right now, but at least it shows that it might work. So, when I talk to healthcare providers, I usually say, why are you listening to a psychologist? And I stole this from a physician in 2004 who said to me, the solutions to patient safety are not in medicine. There's no MRI, no pill, no X-ray. The solutions in psychology. We're talking about communication, coordination, how people get along, how they resolve conflicts. So that's why, I think in psychology, especially the applied psychology side, have been doing these things. And then I stole this from Atul Gawande, medicine is a team sport, no question about it, with 2 exceptions. People's lives depend on it, and there are no coaches, right? So I find these 2 things very compelling. Okay, let's get into the meat of this thing. Are you following me okay? Okay. So I want to argue that to achieve patient safety in the organization, you have to become a high reliability organization. And some of you may know that there's something called the HROs. There's an HRO movement. These are, the nuclear power industry, carriers, aircraft carriers, the aviation industry is seeking to be a high reliability organization and the like. To become a high reliability organization, one of the components is teamwork. No question about it. To achieve good teamwork in the organization, you have to have high reliability teams. And I will argue that in order to have high reliability teams, you have to worry about 7 C's in teamwork. And I'm going to walk you through all of them. Now, I will tell you from the get-go, this is just a heuristic that I've used now to organize the body of knowledge. Okay, so it's not a model, it's not a new theory of teams, it's just a heuristic. Okay. So what I'll do in the next 40 minutes or so is give you what is the state of the science, what matters in teams. Then I decided to give you, outline what are the 10 characteristics of effective teams. This, in a sense, will become a checklist for you. So some of you who want to implement or check, if you will, how you are doing in your units around teamwork, this might be a good checklist, things that you need to look for. Then I'll give you 7 pieces of advice. And of course, so this is going to be very practical. And then some final thoughts. Along here, I'll share with you some of the data on the meta-analysis that we have. Okay. So the science, let me say a little about the science. Essentially, I think for the last 30 years, this science has been trying to answer this question. How do we turn a team of experts into an expert team? Very catchy question. When you peel the onion, if you will, of this question, take a deeper dive, there are 3 things you have to worry about. What is it that you're turning this team into? What is the phenomena that you're turning them into, right? So that is teamwork. That's why we still, today, trying to understand teamwork. And by the way, I'll tell you a few things here. This industry, hello? We're a little busy at this moment. I'll keep going. Healthcare is not the only ones fascinated or obsessed with trying to understand teamwork. There are other industries out there that till today continue to fund, support, and try to understand teamwork. All the way from the military, which continues to do this, aviation continues to do this. The oil industry, I've been doing a lot of work in the oil industry. You might wonder why. The oil industry, well, every time there's a hurricane, they go through the Gulf of Mexico. There are about 3,000 oil rigs in the Gulf of Mexico. And every time there's a hurricane, they have to evacuate all these people. It takes, rapid, they have to do it very quickly. And then once the hurricane is gone, they have to, get back. So coordination, communication of thousands of helicopters and people is paramount to safety and their success. I don't have time today to talk about this, but NASA, one of the most fascinating projects I was telling a group of people yesterday I have now is the astronauts that might go to Mars in 2030. If we go to Mars, the U.S. will, in combination with the Russians, and there'll be a Canadian, by the way, that's what I've been told, we're going to send a team, 6, 7 individuals. The journey is going to be 10 months to get there, 3 or 4 months live there, 10 months to come back. So it's a 28, 30-month journey. Anyway, team cohesion is also paramount to the success of the mission. So it's not only the physical component to that. So NASA has launched tremendous efforts in trying to understand team cohesion, teamwork, and that kind of thing. But back to this question. So, the first thing is you need to know about the phenomena. The second thing is you need to try to measure it, assess it, right? So once you can measure it, assess it, you can understand what the phenomena is, then you can do something about it. So in my opinion, the science has been doing 3 things: trying to understand teamwork, team performance, team effectiveness, trying to come out with tools, techniques, methods, protocols on how to assess teamwork, and then what to do about it. Team training, team building, team composition, very practical things that organizations can do. So today I'm going to talk to you about what is teamwork and what to do about it. The measurement side, if you're interested, send me an email and I'll send you a whole bunch of articles that summarize the good news, the bad news, and the ugly news about measurement, by the way. Okay, so this is the science, and essentially, it has grown tremendously in the last few years. I will tell you that it's a multidisciplinary field. It's not owned by psychology anymore. It's now computer scientists, architects, who else? People in transportation. Everybody's concerned about team-based systems. The emergency medical people as well. So, it's all over the place. So if you do a literature review these days, you'll find discussions of teamwork, team effectiveness, not only in organizational journals, psychology journals, and healthcare journals, but in many other ones. I was telling a story yesterday that not too long ago, I gave a presentation at a furniture company. And after 2 days of being there, giving a talk and everything, I asked the CEO, so, you don't do anything in teams, why am I here? And basically he said, 80% of our customers want furniture, systems, cubicles, that support collaboration and teamwork. So we need to understand what is that we are looking at. So there's an explosion of empirical work, by the way. So when I started my career 30 years ago, most of the team research was essentially sophomore students at colleges performing tasks, contrived tasks in a laboratory. Much of that, what we knew at that time, came from that kind of population. Today, the majority of the studies are done with real experts doing real things. And if we are not looking at teams in the wild, we're looking at them in simulations. So actually, the 15 years that I spent in the military, we spent most of the studies were either we went out there and observed teams, how they perform, or we created simulations that mimic the real world, and then we test them there. So, there's a whole movement out there on this. So there are hundreds of teams that have been studied. A few of them, in healthcare, are beginning to do that. But the bulk of what we know about teams comes from aviation, the military, and corporate. And this is really not true. The majority of the studies come from, in the business world, come from MBA students. Anybody here from the business school? No? Well, professors in business schools will use MBA classes to study teams and projects and that kind of thing. But that's what this means. Corporate world actually does not support a lot of research, but the MBA do that. Okay, now, all teams are not created equal. Okay, so we make a distinction between teams and groups, and while that might sound academic, it is very important because you need to be able to determine, what is it that you're generalizing to when you conduct a study. So when I talk about teams, I have teams that have these three characteristics. Okay, they have high task interdependency. That's a key. Pilot cannot fly without co-pilot. Surgeon cannot finish the surgery without anesthesiologist and nurse, right? You need each other because you have unique information that nobody else has. So that means that the expertise is distributed. And that's why I need to talk to you. That's why I need to coordinate with you. This is why I need to, we need to synchronize what we're doing. And finally, well, actually, there's the third one. The teams that we look at are hierarchically organized. Notice that I don't say they all have a formal leader. They're just hierarchically organized. Sometimes, these days we're into the shared leadership in things like that. But some is in charge at one point. And the final characteristic that I should put there is that there's fluidity in team membership. Most of the teams I know, if not all, team members come and go. That's the problem. Very few stay intact. So the teams that we're talking about, okay, have those four characteristics. Groups, on the other hand, just group problem solving, brainstorming, if you have those, have very low interdependency. Sometimes the expertise is all the same. So, and sometimes there's nobody in charge other than maybe at the beginning of the meeting or something like that. So we make this distinction. Of course, this is a continuum, right? So have teams at this side and groups at this side, and then you have to make sure that you know what kind of team you're talking about. Okay. Everybody follows me so far? Okay. So what is teamwork? Everybody asks about that. So teamwork is a set of actions, events, behaviors, cognitions, and feelings. At the end of the day, teams feel, do, and think. And I'll tell you a little about that. So one of the things that the science has uncovered is, by the way, that there are two tracks that you need to maintain. It's not enough that you know your own job. But the first rule of effective teamwork is you cannot be an effective team member if you don't know your job. In a lot of the things, for example, that I found in the military and aviation is that they use team training as a way to refresh individual training. But you cannot be a good team member if you don't know your own job. So task work is necessary, but not sufficient for effective teamwork. What you need is this what we call the teamwork track or skills. This is how you do things together. Okay? This is relatively easy. This is the one that needs to be built and maintained. So at the end of the day, and I'm going to share with you some of them, Teamwork is a set of interrelated competencies, which I'm going to talk to you about when we talk about the C's. Okay, so and the reason it's very difficult to study this thing, and why, after 50 years, 30 years, whatever term, whatever period you want to talk about, this is very dynamic phenomenon and episodic. That is, it changes, it shifts. And sometimes it's nonverbal. When pilots do this, right? They're not communicating overtly, but they're communicating something, or when they do something like this. So that's why we still, it's very elusive phenomenon, and we still talk about it. Okay. So again, the 7 C's of teamwork. And again, this is just a heuristic. It is not a model. It's not a new theory, but it's a model. And I'm going to walk you through it. And I'll use this to say a few things. So of course, communication is in the middle of all this, right? It's the center of all of this. But like I said the last 2 days here, when I go to organizations, healthcare organizations, and they tell me, we have a big communication problem here, I usually say that is useless to me. Communication is a useless construct because it doesn't give you diagnostic information about what about the communication. Is it because they don't know the job? Is it because they are lost? Is it because they don't like you? Why is it that you have a communication problem? So you have to go deeper. So when I go to organizations, every organization, every healthcare, every hospital that I go, basically say, we have a huge communication problem. I bet you say that here too. And we say, okay, and what do we do about that? So the reason I put it here is because, of course, the communication is at the center of this, but it gets manifested in different ways. And this is why I came up with this thing. Again, this is just a way to organize it. So the first, this is the first C. The second one is cooperation. These are the motivational drivers. I want to be in this team. I like being in this team. I like my teammates. I value the input from my teammates. This is equivalent to team cohesion. I would like to belong to this team. So there's some motivation that you have to worry about. Coordination is the behavioral mechanisms that teams put in place in order to execute a task. Who's going to back me up? Who's going to do what? Okay, that's behavioral mechanisms. This is something you might not think about. Cognition. One of the most interesting things that this science has uncovered the last 10, 15 years is that teams do think. They have mental models about how to execute a task. And you want your teams to have a shared mental model to execute a task. I'll say a little more in a minute. But so we translate that into, this is the common understanding. I know what my goals are. I know who my teammates are. I know what the tasks are, those kind of things. These days, team leaders are coaches. What do? They promote, they develop. That's what team leaders do. Every team, sooner or later, has a conflict. So this is about trust. How do you resolve conflicts in your teams? And what mechanisms, again, you put in place to resolve them? And the final C is conditions. This is the norms, the support, the policies, the procedures that you have in your organizations to support teamwork. I think I already said this, so those who know the answer, please don't participate in this part. Somebody, about a year or two ago, when I was trying to test this model, asked me, if I put a gun to your head, which of these C's is more important for teamwork? Guess what I said? Not that. Which C is the most important? Anybody? This is the audience participation part, by the way. Conflict resolution? Conditions. Communication? You're right. What I said was conditions. And I'm convinced after 30 years of working in this area that if the organization does not send signals, if the organization is not set to promote, to reinforce, is not aligned to support teamwork, you'll never get the behaviors. You can have the best team training in the world. You can have the best teams around here, motivated, good team coaches, etc., etc. And these things are not in place, you'll never get the behaviors. So the biggest failures that I've seen in healthcare of systems, healthcare systems that have deployed team training at millions of dollars. 3 years later, they're saying, how come we're not getting the behaviors that we want? And I go in, and this is the only thing I focus on. So let me talk to your CEO. Let me talk to your CFO, to your CMO, all the O's that I can find. And let me tell you, what is it that you're doing? So I think that, and I hope that there's some deans or leaders here, this is what matters the most. So I hope this is a good message, or a message that you have to take, which is you have to have your leadership engaged in this. So teamwork in this movement in patient safety is about cultural change. And I'm going to show you the data that supports that in a minute. Okay. So let me walk you through some of these competencies, some of the C's. So, in cooperation, there are two competencies that are very powerful. One is collective efficacy, essentially the belief that the team has that they can perform the task. Very powerful predictor. So one of the things you want is to have your teams to feel confident about what they're doing. In many industries, sometimes including healthcare, the first thing they want to do is they want to break the team. In the military, that was the first thing I try to tell instructors, don't do that. Because their motto was, we're going to break the team and then we're going to lift them up. And then collective efficacy will suffer. If you have good collective efficacy, again, confidence, what happens? You're motivated, you persevere, because you think you can do it, and you try different things, and you're there. So this is good. Team orientation or collective orientation is another predictor. Unfortunately, this is a disposition. Difficult to train. All of us, all of you, all of us here have a disposition. Either we're collective oriented or we're ego oriented. And the ego oriented people are, I'm sure you know some of them, we call them the lone wolves, right? These are the people who, no matter what you do, they will never engage in teamwork. They're loners, right? So this is a selection issue. And the good news is that there's a lot of research now going on in selection issue. And I can tell you, because I've been in meetings, in 2018, the AAMC hopes to launch a test for medical students, to select medical students, based on collective orientation, to see if you're collective oriented. So the military is doing, the aviation too. They want to bring into the organization people who are collective oriented. So they're using situational judgment tests, a number of other tests to do that. This still not quite there, the science is not quite there, but this is what people are interested in. The good news about this, I've read a few articles recently, that there are people who are egocentric, but at the time, depending on the conditions, they become collective oriented. Once those conditions are gone, they become again ego-centered. So along each of these slides that I'm going to show you, there's going to be a few tips and stuff like that. Behavioral mechanisms, coordination. So to me, the core of effective teams is these three things. Mutual performance monitoring is essentially situation awareness, kind of. Somebody asked me that yesterday, but it's a scanning of the environment. Effective teams have team members that are always scanning their surroundings. They're aware of what's going on here, what's going on here. So when something happens, then they can do backup behavior. Hey, I understand you're under stress. What can I do to help you? They jump in. If they jump in, they're adaptable and flexible, which is exactly what you want your teams to be. Flexible, adaptable. They shift depending on the conditions that they are in. Communication, like I said, to me, just about closed-loop communication, and it's about this. Appropriate terminology, how precise it is, the timely, and clarity. Cognition. So here's, one of the things we were doing experiments in the military, and these are real people doing real things in the simulation, actually. And we were cranking workload, increasing stress. And what we were finding was some teams will perform well under those conditions without talking to each other. And we couldn't, what's going on here? We're trying to break this team, a lot of stress, and they still perform well. But there was zero communication. What we found, and what we hypothesized, is that they had a shared mental model. under stress, they were anticipating the needs of each other, and they were passing information without somebody asking for it, which is exactly what you want your teams to do. So the nurse passes the instrument to the surgeon without him or she requesting it. Co-pilot passes information to the pilot without him or she. I'll give you a sports analogy. It won't be hockey. In basketball, the no-look pass or the blind pass, what is that? Two people who read the cues in the environment, have the defense's position, how much time they have in the clock, and they execute a task without saying, hey, here goes the ball. Right? You seen those? And so that's what you want your teams to do. So I'll say a little more about this, but to have a shared understanding, you need to understand all of this. And let me say a little about familiarity. So we found, the science has found that familiarity, too little familiarity, bad thing. A lot of familiarity, bad thing. It's an inverted U relationship, right? So if you know there were a few accidents in the 80s. I can tell you one, US Air in LaGuardia, I remember because I read the transcript in the interviews. Pilot, co-pilot are taxiing, about to take off. They've been flying for a long time. Pilot thinks co-pilot is going to lift. Co-pilot thinks pilot is going to lift. None of them did this. Plane went to the river. Thank God nobody died. But that is what now, in the 80s, all those accidents and stuff, because teams that are very familiar develop complacency. That's why crews rotate, by the way, now. But familiarity is, all of us use that. In whatever we do, we make an assessment of the expertise of our teammates. And based on that assessment, we adjust our behavior. So I'm going to make this in softball. Forgive me, I don't know hockey real well. So, let's say Mary is playing in, she's the second base, and I'm the shortstop. And I know that this is the first time she's playing. So I don't trust her, right? So familiarity, low familiarity. So I'm going to be close to her, make sure that she doesn't mess up. But if I have Jane, and I know she's played with us, and she has a lot of experience, I leave her alone. So familiarity and the judgment we make about our teammates, okay, on the basis of that, we make an adjustment on how close and what do we do. So familiarity, and also, it talks about trust, and I'll talk a little more on that. Leadership, very quickly, this is what effective teams leaders do. Very straightforward. I'll say more about that in a minute. Conflict resolution, it's about psychological safety. And psychological safety is the lingo that we use to say, I have license to speak up. I have license to say, we messed up here, and let's do something about it. I think it is the biggest challenge in healthcare, to create psychological safety so that people speak up when things don't go well. And I'll tell you how do you get that in a minute. And here are the conditions. Please memorize this, and go and tell your leaders, your deans, your CMOs, that this is what matters the most. At the end, you can deploy team training, you can do all those things, but if everything's not aligned, I'll give you some other things that's going on in addition to the AAMC thing I told you. So I've been briefing in the past few months with Jaco. So I think Jaco eventually wants to go to a hospital, and without talking to anybody, get a feel whether there's teamwork or not in the organization. What's on the walls? How are the people behaving? So there's some research that's going on. I think it's going to take 5 years. I mean, they're far away from regulating hospitals about teamwork yet, but it's headed that way. Okay, and it's about this. Okay, so very quickly, 10 characteristics of effective teams. So here's a checklist. And the number one is no surprise, because I heard it the last 2 days. Most of you talking. And the way I describe this, the reason I have a career is because this is the problem. The number one killer of teamwork is that team members don't know what they're doing and why they're doing it. This is a 3-minute, 2-minute fix by a team leader, by a supervisor. I interview a lot of people in the last 30 years, especially in corporate and actually sometimes in healthcare, and I'll say, so why are you here? I don't know. Why are you here in this team? I don't know. My boss told me to be here. And why are you here? I don't know. We're going to find out. I mean, that's what goes on. I can tell you some of the things. One of the most fascinating consulting gigs I did was for Return to Flight, NASA. This is in 2004, 2005, before we were launching the shuttle. We stopped launching now, but so after the Columbia accident. I needed, as a teamwork expert, I needed to certify that we were ready to return to flight. I interviewed the 26 people and observed the launch of the shuttle. And I would ask them, they all sit, and I see them on TV, CNN, in the U-shaped thing in Johnson Space Center. They had no clue who was next to them and what their role was. So for 3 months, we got into a role clarity exercise. So this happens all over. Okay, but this is an easy fix. Number 2 reason, effective teams have a compelling purpose, reason to be there, and a goal, because this energizes them. Here's what team coaches do. All of these bullets here are specific behaviors that the science has shown. If the team leader does this, it leads to better performance. So let me give you 2. To self-correct first. And as I explain this, see if this happens in your units. We just came out of the OR, and I'm the surgeon, and I grab my team here. Hey, before you all go, let's talk about what just happened here. And then I say, I didn't do well today. I should have done this, and that, and next time I'm going to do this, and that, so we can be better. I'm disclosing. I'm the leader. I'm the surgeon. Guess what happens? Psychological safety. Then I just gave everybody license to speak up because I self-disclose first. Industries that do that, then correct their problems. They get better. Does that happen here? You don't have to tell me. But self-correction, when the team leader does that. The other one is provide situation updates. And the reason I use that is, there are many surgeries, for example, in many instances where, and I've observed several heart surgeries, where hours go by and nobody says a word, but everybody's performing, doing things. So what happens if there's a little, something doesn't go well, something unplanned happens? One way to maintain a shared mental model so that everybody's in the same sheet of music is to provide periodic situation updates. You lift your head, we teach this to the leaders, and say, this is what I'm thinking, this is what I'm doing right now. And you just say something for 30 seconds so everybody knows. Because if something happens, then you just got updated on where he or she is, and then you can act on that. So all of these other things, by the way, have shown to be effective in team leaders. And this is real people doing real things. And some of them is in healthcare, by the way. Mutual trust, familiarity, I already said something about that, but we can spend hours talking about this. But at the end of the day, as you know, this is one of the things that takes a long time to get and takes about a second to lose. And this is a process. But effective teams have that so that they can resolve conflicts and do things. They have clear norms, inappropriate norms. They have a shared understanding of the task. One of the things is how do you keep this? How do you ensure that they have a shared mental model? The way you do it is through this. If there's one thing you get out of this presentation other than the conditions, is that I hope that you huddle and debrief. This is why you need, it is very simple, powerful, yet underutilized or abused technique. The huddle solves a problem right now. Debrief is for future problems. But this is what it does. So there's ample data now. As a matter of fact, a meta-analysis was just published. Teams that debrief outperform those that don't by 20%. And I know this is a challenge in healthcare because every time I go, most people say, I don't have time for debrief. But like I was saying yesterday, there's a site called debriefnow.com. It was funded for healthcare. So go debrief.now. debriefnow.com. Soon, I was telling them there are going to be applications on debriefing. So let's say the three of us are in surgery. We don't have time to debrief. We go home. I open my application. I answer 6, 7, 8 questions. She does 2. She does 2. And the algorithm behind the application tells us, oh, yep, we need to talk because we're different about what just happened. So there's a lot of technology being developed around debriefing, but do it. They set expectations. Here's another thing. Effective teams share unique information. For this is why you huddle. That's why you say, hey, wait a second. We've been talking about the same thing for the last 10 minutes. You're passing around the same information. That's why teams get bogged down. How come we get no progress? We're passing the same information in different forms, different colors, but it's the same information. So huddles and team leaders are the ones that do this. And the last one is they have organizational conditions to do that. I'm going to run out of time here. So 7 pieces of advice. So again, there's more than 10, but those are the top 10. I have a paper that has at least 20 some of these things, different. But I hope that you get a feel for what are the things you need to do, and your teams to do that. 7 pieces of advice. The first one, of course, is team training. And I want the focus around the 6 of the C's. I want to make a distinction here between team training and team building. They're not the same thing. And like I said yesterday, team building is the #1 human resource intervention in the world. In Orlando, there are 3 businesses completely devoted to team building. One is around kitchen, and you learn to cook and that kind of thing. Another one is around horses. And the other one is around, I forgot. But essentially is, corporations and 7, 8 people, executives, the team, to wine and dine somewhere 2, 3 days, and you do things that have nothing to do with the job, right? You're cooking, and you have fun, all that kind of things. I did a meta-analysis in '99 that said basically team building effects, 0 correlation with performance. A lot of consultants didn't like that, but it's 0 correlation with team building. At most, it gives you role clarity. Team training is about competencies, it's about knowledge, skills, and attitudes. So they're very different. Okay. Team training, and there are, I'm going to disclose, I was one of the scientists behind Team Steps. So that's one program out there. I'm not really saying you should do Team Steps, use whatever it fits you, but ensure that whatever you do, the team training has a little information, demonstration, practice, and feedback, that the scenarios, if you use simulation, is carefully crafted, and I'll say a little more, I think, the next one. So here's the team training work. So a little of the data. Yes, thank you very much. So I did studies for the military, because in the military, when we were doing all this team stuff, the Pentagon will ask us, how do we know all this stuff is making a difference? So we did studies. These are now real people. This is command and control teams. And this is the effects that we found. % improvement after team training. We published that in a book. I did a lot of aviation work also. And this is what % improvements we find. Some people usually ask me, 6%. 6%, isn't that low? And this is how I answer that. So these are pilots with 10,000, 15,000 hours. Very senior, experienced pilots. If we get them to do one more behavior that saves the aircraft, which could be that 6%, that's good enough. So we were able to show that even, old dogs can learn new tricks. And these studies are being published in Human Factors and in other journals. But the question is, here's a meta-analysis I did in '08. These are raw, by the way. This is not p-values. And essentially, what this shows, once you do the math, it's about 20% improvement. That's what team training does. Does team test work? Here are some studies. We did one for a hospital, a longitudinal study. This is what we found. I'm going to let you read some of these things. We were able to change behavior in the OR. But unfortunately, this is one of the biggest challenges in teamwork. That's why conditions matter. This is a longitudinal study. So we measured them every 3 months. We went to the ORs and observed them. After training, 3 months later, 6 months, 12 months. The sustainment of the behaviors is difficult. Does medical treatment impact clinical outcomes? Here are some of the studies. In labor and delivery, in trauma. Some of this have been done in, by the way, in Afghanistan. There have been 2 experiments, 2 team training evaluations in Afghanistan. Again, all the references are there. This is the one, right? This is the Neely study. Essentially, it's a 50% reduction in risk. So this is the VA. These are organizations. So what they did was they team trained several hospitals, and others did not. And this is the difference they found between organizations. Again, very compelling data. Our new meta-analysis shows that it's 25%. We have, again, 255 articles, of them codable for quantitative review are about 130. Medical team training across the world, team training accounts for 25% of the variance in team performance, which is good news and it's bad news. The good news is 25%, a whopping effect. Bad news is to achieve patient safety, to become higher reliability organizations. Team training alone won't do it. There's still 75% out there that you need to do something about. Another advice, teach how to debrief and huddle. This is the meta-analysis published in Human Factors. Actually, 25% improvement. Simulation, we talked about that. No question about it. Simulation works. But I've been in this area also for a long, long time. To me, simulation by itself doesn't train anybody. Exposing people to a task, putting somebody in a scenario, doesn't mean they're going to learn the right things. As a matter of fact, there's data that suggests that they will learn the wrong thing, get the wrong mental model about what needs to be done. So the only thing, well, not the only, but what matters in simulation is the instructional features, learning objectives, measurement, assessment, because that's the basis for debriefing, feedback. The scenario has to be crafted such that it elicits the behaviors that you want to assess and train, not the latest thing that just happened. And most of you who are clinical are very good at coming up with scenarios, but in simulation-based training, the scenario is the curriculum. So the scenario has to be carefully crafted to elicit the behaviors you want. Develop coaches and leaders. Here's another line that you should remember. Organizations get the behaviors and cognitions that they measure and reinforce, period. Let me say that again because it's simple, but it's the science is clear on this. Organizations get the behaviors and cognitions, the way you think about it, that you measure and reinforce. And we are very good at finding what those are. Depends what our boss emphasizes, right? So you want teamwork in your unit, in the hospital, at the university here, measure it, reinforce it, incentivize it. Create the conditions. Here's some of that. Physicians must engage. Okay, so I've been doing this for 15 years in healthcare, actually, since the IAM report. There's still some resistance there. No offense to anybody here who might be a physician, but there's still some resistance. And I was telling the story here this afternoon, I've been here too long now, 40 hours. I was giving this presentation like this to a group of you, and somebody that stood up and did one of these and walk away. After the Q&A, people said that physician was the problem. I mean, he was a physician who didn't care about all this stuff, and in the middle of the presentation, just walk away. So there's still some resistance. And the other point here is, people think that the team training will solve it as an event. And again, you only get 25%. You have to do some other things. It's about the culture, the leadership, it's some other things. Read that. I found this, a poster in an OR in a hospital in Jacksonville, Florida, military hospital. So what the CMO of the hospital does, it makes every surgeon goes to this board. It's a poster before OR, and they have to read this. Can you put this here? And what would happen? Interesting. But he claims, I mean, and I've interviewed, and I've been there in Jacksonville, semi-local to where I live, and it's just fascinating how a simple intervention like this, a poster, makes a big difference. So, more advice. Make sure you deploy your teams. These things I think I already talked about. But one of the things that also is key from the science is when you assemble a team and if you don't set the conditions, the culture, right then, you don't, in other words, you don't deploy them correctly. Then you're going to have problems recuperating later. So the things you say at the beginning, you as the leader, are critical. I think that's it. Final thoughts. So, effective teamwork is the foundation for effective patient care. I think there's a science there. I hope you got a feel for that. Remember the 7 C's. It works. It helps you organize this thing. How can I help? That's it. Thank you very much. Here are the references. Questions? Rebuttals? And again, the presentation, I can give it to you. All the references that I've used are there. Yes.
Thank you very much. That was a wonderful, wonderful talk, and the 40 minutes went by like that, so that's a great thing.
Actually, 50, but that's okay.
I just had a couple of questions. One is you talked about how small teams and teams that don't rotate become complacent. Often in healthcare, we end up with very specialized skills, and just by out of necessity, the teams have to be very small and very contained. We don't have that luxury. How do you? What would you recommend to prevent teams from being complacent?
Debrief things in huddle and self-correct as much as possible. I'm sure things won't go smooth all the time, so self-correct. So as opposed to what most people they get a little lazy about things. Oh well, Joe today was not in a good day. No, spend the time and say, hey, let's talk about it. So Joe, what happened today? It might be something that sort, but the self-correction it's what's needed. And for that, you have to have a discipline. In the military, the aviation, in other industries, where safety is paramount to whatever they do, they have everything is debriefing, everything is huddle, everything is, hey, let's talk about this. I've seen that in the oil industry as well. I've spent 3 days in an oil rig, which was 2 days too long, but everything there is safety, and you debrief and you talk and. It's incredible. So, but you have to have the discipline to do this. And when you have the problems is when you do once, then it's so. To me, the advice is debrief. Is one way to.
You also mentioned for us, to have effective teamwork in your organization, your upper executive has to be invested in it. You mentioned yesterday, people say they do this because it's written in their mission statement, but what in your mind is tangible evidence that your upper executive is actually really means it when they talk about teamwork?
Yeah, so it's what they say every day and it's what they do. So I go to organizations where they're talking about safety, and in some cases, not necessarily the CEO, but the chief safety officer, let's say, if they have one, it's at all the meetings. You send a signal, wow, this guy's here, or person. It's subtle as that, by the way. It is not, they have to be a cheerleader, or it's just that the message you send, and you do it consistently, and you participate in the activities, and you show that this matters to you and to the organization, and it eventually matters to them, then that's what they do. Most organizations that are very good at this, the CEOs, CFOs are in the middle of it. They put the time. So you think, CEOs are very busy people. So you say, this guy is coming down to talk to us about safety, about this, about teamwork. you say, wow, it's a priority. It sends a signal that. So it's those kind of things. There are some that do that. There's some hospitals that have been small, not as big as I think you are here, or that the CMO especially, Chief Medical Officer, comes to all these briefings and stuff like that. And then it sends this sense that, we're a family here. This is not the guys from the boardroom. So it's that kind of thing. It's very subtle, but it's very powerful when they do those kind of things.
Hi. I was wondering also with regards to that issue of when teams become too familiar with each other, they can become complacent. So I was just wondering if families can be teams based on that,
Families?
or are families more like
Of
groups?
course. Well, if there's interdependency in families, there's actually, there's a lot of research in therapies, family therapies, that not necessarily in this presentation, but I've used nuggets from research that comes out of families, therapies and the like to show how teams might work. But in therapy, one of the things that it's all about expectations. For example, how to manage expectations, and that's what the team in teams. People get disappointed when you think that team is going to do X and then you end up doing Y. So it's about matching the expectations. So it's a family. As a matter of fact, this NASA work that I'm doing, really, when we interview the astronauts and you're in this confined environment for so long, you become a family. So the issues that irritate families irritates them. It's just like that. But that's another literature that ought to be exploited more. Family therapies and that kind of. But a lot of what I talked about, I think, applies also to education systems, to laboratories, people who do research in labs and that kind of thing.
Thank you very much. That was a really interesting talk. So one of my areas of interest is sort of process and efficiency. So I was really encouraged to see that you've found some data in that regard as well. I was wondering if you could comment on the role of physical proximity. So when I think about processes, scheduling, for example, you've got a secretary in the doc's office, you've got a lab facility where there's scheduling going on, and often there's coordination of care that's required. And I mean, to me, that's a team.
Sure.
I wonder if you could comment on the fact that people aren't physically going to necessarily be in the same space. How do you actually mitigate the barriers that go along with an effective team in that regard? And I think virtual teams would be the same thing, right?
Yeah, right. So yeah, that's a good point. So yeah, there's not a lot of literature on there, but what the virtual team people are doing are saying, so again, huddles and debriefs are one way to do it, to communicate. The other thing is, one way to keep everybody in a shared mental model is not only debriefing, but in the virtual, I've seen research that shows that you need to create time for familiarity, for example. Let's say it's Monday and we are all dispersed, and we can talk. We have a conference call, let's say, and the first 5 minutes, I want you to talk about your kids. Get people, and you, what do you do on weekends, on hobbies? And so people will spend, and they get familiar with each other, and so that's how you build all this stuff. But it is very difficult in a virtual environment when there's proximity, when you have distance, to keep a shared mental model. So I did a lot of work with banks where the teams were distributed all over the world, and how to keep them thinking about how to maintain the shared mental model. The best strategy that we found was this little familiarity, and the second one was that the team leader was much more active in bringing people together and making sure everybody participated, everybody felt part of the team. So it's about creating the teamness. So it was the team leader did that. So that might help. But it's again, and especially in those teams, it's discipline, because you can lose all that teamness in 2 seconds. That kind of thing.
Thank you very much for a very, very good talk. Thank you. In healthcare, especially in educational settings, teams get put together almost randomly, part of the process. And I wonder if you would comment on ways to manage the huge amount of information that we have to deal with day to day in patients. You mentioned at one point that teams would often keep rediscussing or sharing the same information, but within these teams there are different skill sets that we don't spend a lot of time on changing while we're together for short times. And yet I wonder how much of this plays a role in performance gaps, the 75%, and what you would consider offering in short times to try and be more effective at managing the information, whether it's based on evidence-based or patient care or information around other people's roles in the team.
Yeah, it's going to boil down to a few strategies. So, it might be different problems, like you're illustrating here, but again, I'm going to sound like a broken record. Try huddles. You see what they're doing, timeouts. You see, do we have the information we need here to make a decision? Electronic records is also helping a little bit with that. But it's all about, in my view, this is going to sound, it's quite simple. The thing is, so don't try to look for, there's, some magical thing out there that we need to create and design and test. Most of the stuff is out there. It's just about how you implement it. So without knowing much about the case you're referring to, I would say, let's debrief. Let's talk about this. Even if it's 30 seconds. Let's huddle. Do we have all the information we need? Why are we repeating this, the same thing over and over again? What are we missing? So another strategy that I use when deploying a team, for example, that might help that is, I also usually ask, what can make this team fail? What will make us fail? Let's predict that. And that everyone in the team says something about it. And then you realize that that's why you realize, well, somebody doesn't have the information that they need, somebody, operates a little different than what you think, and you talk about. So again, it's just about talking about these things and stopping and having the discipline to stop. That's the problem. Teams, because of the job pressures, they keep doing, keep performing or trying to perform, and they don't stop and they say, okay, let's see what we're doing here, and that will work. I can tell you that will work.
It may be that I'm going to ask you a question that you'll answer huddle to again. However, I'm curious about your commitment to coaching and psychological safety, because I often see that coaching turns into kind of negative feedback, and I think there's an important distinction, and I wonder if you could share some thoughts about that.
Yeah. So for team leaders, huddle won't do it. You have to teach team leaders to do certain things and to be developmental and to coach. Not everybody is born a coach. So these things you can develop. So there are team leader training programs out there. Teams that has one of the modules, I believe, they focus on the leader, what to do. So that you have to teach, you have to reinforce. But most important, team leaders have to believe that what they're doing, the coaching they're doing, is good. A lot of team coaches, especially or a lot of team leaders, especially in healthcare, in my view, no offense, have own models about how to instruct, how to mentor, how to develop. And some have been trained they change their behaviors, but I think that's a different, huddle won't do it. As a matter of fact, huddles when a team leader coach that is bad is even worse, because you don't want to huddle, you don't want to say anything, you don't want to listen to this. But my students also tell me that I don't give, like most professors don't give a lot of positive feedback. So I usually tell them, positive feedback is overrated. But I do tell them how to develop, how to be better themselves, and that's what team coaches ought to do. So it's not about being a cheerleader; it's about what just happened. We need to do something better, and what is it that I need to do so that you become better. But those are things. Those are trainable things, and there are very specific guidance. I can send you a paper. I have a couple of papers on what team leaders ought to do, very specific, in a team setting, of course, that I can send you.
We've got time for probably just one more question. Thanks again for a very provocative talk. I work a lot with the medical students, and I definitely believe personally that team training can't start too soon, and we like to try to introduce some of the concepts early on. But you made a good point that unless you have expertise in your task, like that's the bare minimum to be an excellent team member. And a lot of the times we're at the same time trying to train them for specific tasks. And there's a lot of new information going on. And sometimes I have this tension internally between how much can I afford to talk about team dynamics when I have so much to focus on specific task pieces. Having said that, the earlier you introduce it, the more I think you're talking about the condition and the culture.
Right.
So it's this tension I deal with, and I wonder if there's any evidence as to when the best time is to start team training in the training of these eventual experts and the team leaders eventually.
Yeah, good question. So we talked, I think, about that yesterday. So let me see if I have a slide. But so this is how I do this. I think about this. Training in actually education does 5 things in my mind. Very simple. They provide information, information of concepts that gives you, what things are. It demonstrates behaviors, good, bad, or otherwise. Videotapes, role playing, that kind of thing. Allows you to practice, simulation, whatever. It gives you feedback, and remediates. That's what training does. So in this, and the institutions they're doing this. So from the first day that the medical student shows up, they start giving information about what is teamwork. And as they progress, then they begin to say, okay, let's demonstrate this. So they must see a video, they must see a tape, they must see a simulation of other people doing, and then they get a little at it. Then eventually they practice, and then they get feedback and so forth. So what I'm suggesting is you have to lay it out such a way that, indeed, as they're learning their own task, you don't want them to practice on things that they don't really know. But you can give information. This is what we know from teams. This is what effective teams do. This is why you need to engage in a team. Because look at the errors, and you can show tapes. And there are lots of videos now, very compelling videos of medical errors in teams. And so you infuse it little by little. But I will start from day one. And then at one moment you practice, you have to see where the curriculum is. I cannot give you a specific thing, but at one moment you really, it's when you think that they are about ready to go and see patients, and then you begin to practice. Now it's a team sport. Let's bring them together, and you get feedback. So in the schools that I've seen successful trying to do this, so creating a culture, so by the time they, in the 4th, 5th, 6th year, whenever, they already know these things at the start of day one with a lecture. And sometimes it's given by the dean of the school that says, this is important, and that's how you send signals. Oh, teamwork, I didn't think about it. So, but I think you start from the day one. Give them 1 hour. I tell you who does it real well is Vanderbilt in the US. They have a whole set of activities that around teams work that they put throughout the curriculum.
Thank Dr. Salas again for a great talk and for being with us for the rest of the day also.
Thank you.